Hi, my name is Karina James Scribner, and the research study that we utilize to describe statistical conclusion validity is a study on empathy training for medical students in Germany. The objective of the study was to evaluate whether or not medical students could learn to be empathetic after receiving specific training on empathy. 158 medical students were randomly assigned to either the intervention group or the control group. The intervention group received empathy training that included an introductory class on the topic, and then 2 skill sessions where each student completed 4 different stations with simulated psychiatric patients. After each encounter, the students completed a self-assessment, and then feedback and discussion was provided by the simulated patients and the student observers. The control group attended a general seminar on psychiatric topics that were unrelated to empathy, and participants of the control group also participated in small group discussions on medical history. Training duration for both of these groups was equal in length. Data was collected during objective clinical structured examinations, which are also known as OCSEs. Prior to the OCSEs, where the medical students are going to be evaluated on their empathetic abilities, the researchers identified evaluators who either acted as expert observers or participated in the study as simulated patients. The identified evaluators received 5 hours of training about the empathy constructs and the rating instruments used for the study prior to conducting the OCSEs. The researchers created 4 OCSE stations with simulated patients presenting with different psychiatric diagnoses. Each station lasted 10 minutes. Participants from both the control and intervention groups participated in the OCSE. The evaluators were blinded to the students' assigned groups. Evaluators used a questionnaire and interview techniques to evaluate empathetic communication skills of the medical students. Medical students also completed the German student version of the Jefferson Scale of Physician Empathy, which assesses the attitudes the students have with empathy themes. All analysis was completed with SPSS 23.0. The level of significance was set at p is less than 0.05 using a two-tailed test. The statistical significance of the study indicates empathy training may improve empathy skills in medical students. So in conclusion, incorporating empathy training into medical school curriculum could be beneficial in increasing empathy skills in future medical professionals.